Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam from Houston, Texas. Today, we are going to talk about Medicare Part A. What does Medicare Part A cover and what does Medicare Part A does not cover? So we're going to take you right from the time you register yourself for Medicare and then see all the things that are covered and not covered by Medicare Part A. When you are close to retirement, say for example, you are close to 65, then you need to be thinking about getting your Medicare parts in line. And this is how a Medicare health insurance card looks like. It has Part A and Part B with your name and Medicare number. Medicare is much more than just an insurance for senior citizens. Medicare is the most complex insurance company. It is the largest insurance company in the country. It covers close to so many millions of seniors above the age of 65, and it also covers individuals who are below 65 if they are disabled or if they have chronic kidney disease and if they are on dialysis for 3 years or longer. And these guidelines change from year to year, but nonetheless, so this is what Medicare covers as far as the broad population is concerned. So let us look at the ABCD of Medicare to start with, and then we'll focus on Part A. Part A is the hospital insurance, it's the Medicare's hospital insurance part. Part A pays for the hospital charges. Not all of it, but most of it, and we're going to look into that. Part B refers to the physician's charges, x-rays, labs, medical equipments, etc. We have to apply for Medicare Part B. If we don't, then we have a chance of not getting coverage on a timely basis. I'm going to cover that one in a minute. Part C is a hybrid, which is known as the Medicare Advantage plan, which sort of combines Part A and Part B together, and in some cases even Part D, which is a prescription plan. Part D is basically a prescription plan, but nowadays majority of this Part C cover the prescription plan in some manner or the other. Okay, let's talk about some of the details that are covered by these various parts. I'm just going to focus on Part A. The rest of it, you can read it. Part A covers hospital charges. It doesn't cover 100% of the hospital charges. You have a deductible, which can be $1,000 or $1,500, depending upon which year you're watching this video. And after that, you also have a copay, which you have to pay. Part A is something you don't have to apply for. Once you turn age 65, on the birthday that year, you will be automatically eligible for Medicare Part A. You will get a card in the mail, or you can go to the website and print a card for your Medicare Part A coverage. Part B, as I told you, covers the physician charges, laboratories, x-rays, equipments, and oxygen supply, things like that. And Part B is something we have to apply for. Part C we talked about. Let's move on to the next part. There are a lot of things that are not covered by Medicare. Just because you paid for Social Security and for Medicare for 40 or 50 years, don't think that Medicare is going to cover every dollar of your healthcare expense. In fact, it doesn't cover the most expensive medical requirements, such as long-term care or expensive medications, or, for example, expensive procedures. Some of them may not be covered. Okay, first of all, how do you enroll into Medicare Part B? It is very important to enroll into Medicare Part B because this is an integral part of Medicare Part A, because together they provide the hospital side and the physician side of the Medicare charges that will be paid by the insurance company. So let's assume your birthday was on May 15, 1945. So you should be turning 65 by year 2010. So based on your birthday, 4 months before your birthday to 3 months after your birthday, this 7-month period is the time when you can enroll into Medicare Part B. I'm talking about B. Yes, the topic is Part A, but Part B is very important to supplement Part A. So that's why I'm just giving you a heads up so that you get started early, because this is something you have to do in advance. Because if you wait after August 15th, that is past 7-month window, then you have to wait for the regular enrollment period, which is going to start towards November or October. The most important website you need to bookmark on your computer is Medicare.gov. And here is the address, simply www.medicare.gov. This is where you need to read every possible page to see what is covered, what is not covered, what is your premium due for Medicare Part B, C, or D, and what are the Medicare supplement plans, which we haven't even touched about. And all these things are covered under Medicare.gov. Okay, let's talk about what does Medicare A really cover. As I said, Medicare Part A covers hospital charges, but they don't cover everything. Let us see what they cover. Let's say you were admitted to the hospital and you have to spend 60 days in the hospital. The hospital charges are covered by Medicare 100%, except that you have an annual deductible, which is like $1,400. It could be $1,600 by the time you read this video. It changes from year to year. But nonetheless, you have an initial deductible which you have to pay. Days between 61 and 90, you have to pay a copay of $352 per day for every day you spend in the hospital. That means days between 61 and 90 days, you have a $10,560 out-of-pocket cost if you are in the hospital. God forbid, if someone needs to be in the hospital beyond 3 months, up to 150 days, then the cost per day doubles, $704. Again, these numbers can change, but we are just learning the concept. And you may look at putting $42,240 out of your pocket to cover those hospital days. Beyond 150 days, Medicare does not pay anything. If you have a medical condition, if you are admitted to the hospital and you are in the hospital for a month, you go back home, and if you come back within 6 months, it is considered a continuation of the previous admission. So the days add up. But if you are in the hospital for a month, then 8 months later you come and readmitted for a same or a different situation. So that is a different admission, and there the continuation clause doesn't apply. What else does Medicare Part A cover? We heard a lot of things it's not covering. So please, could you tell me what does Medicare Part A cover? We talked about the hospital charges. Have patience. We talked about the hospital charges. The skilled nursing care in an institution like a long-term care is covered. How much is covered? The first 20 days, the Medicare pays 100%. Let's say, for example, a senior citizen was admitted to the hospital with COPD and pneumonia. 3 days later, the patient gets better. Now, the patient is too weak to go home and take care of herself or himself. So the patient will be transferred to a skilled nursing facility where he may need more treatment with inhalers, nebulizers, antibiotics, and he can stay in a skilled nursing care or a long-term care for 20 days, and 100% of the charges are covered by Medicare. Between days 20 and 100, you have to pay a copay of $176. That can change per day. That means an out-of-pocket of almost $14,000 if you have to stay there for an extended period of time in a skilled nursing care while you're recuperating from your COPD and a bad case of pneumonia. Medicare as primary or secondary. There are situations where you are 65, but you're not ready to retire. You got a good job and you're the vice president or the CEO, so you want to continue to work. But here is a catch. If you continue to work, the group insurance that you are enjoying from your company will become the primary. The Medicare will become your secondary insurance. Okay, let's talk about Medicare B Premium. As I told you, Medicare B is something you have to apply for, and that is the window during which you apply, the 7-month window I talked about, and then you will be eligible for the Medicare Part B in the month of July of that year you apply. Here's a catch. If you're making a $300,000 salary, then the Medicare will penalize you 1% of your salary for every $100,000 income. So if the Medicare regular premium is $200 and you're making an income of $300,000, you end up paying $300 extra. So your premium, instead of being $200, will be $200 plus $300. That will be $500 per month. You don't have a choice. Either you can quit your job and reduce your income if you want to reduce your Medicare Part B premium. That is something that I wanted to throw in because most people don't understand that. Now, the Medicare Part A partial coverage things come up. Mental illness. Mental illness is covered for a maximum of 190 days. Beyond 190 days, you're on your own. Medications. Any medications given in the hospital setup are covered 100%. Any medications that you get outside as a prescription or from a doctor's office, it is not covered. You either have a prescription plan or Medicare Advantage plan, which will cover your prescriptions. Okay, outpatient surgical care. 80% is covered by Medicare, whereas 20% is your share. Preventative care, as you see with these Medicare Advantage plans, Medicare Part A does not cover. Even Part B does not cover. Preventative care, routine dental care, eye examinations, all these things are kaput, not covered by either Medicare Part A or Medicare Part B. Here are a couple of other things that Medicare Part A covers. Home health care, 100% covered, 80% for equipments, and you pay 20% copay for equipment. Hospice care, you should be under the care of a doctor. As long as you have a doctor's direction, it is covered 100%, with some exception. Blood. I don't know where they came up with this concept that the first 3 units of blood, you pay for that, while Medicare pays for the next 70 units or 80 units, whatever you may need. I have no clue why they got this one. This is just not science. I know you're getting fed up. I said, well, Medicare doesn't cover this, Medicare doesn't cover that, Medicare Part A is not taking care of that. I said, would you please tell us what the Medicare Part A doesn't cover? I'm coming to that. Here is the list. We talked about some of these things, but I'm going to expand on all these things, and that will give you a much better idea as what is Medicare not covering. Yes, long-term care, which is an important aspect as we get older, is not covered by Medicare. And all the services that are provided by long-term care, like skilled nursing facilities or custodial care or kind of a home health care, all these things are not covered by Medicare. I already talked about first 3 points of blood. Medicare Part A does not cover dental, routine eye examinations, hearing aids, prescription drugs, and anything beyond 190 days of hospitalization. It doesn't cover for your routine eyeglasses. And remember, foreign emergency care is not covered by your regular Medicare Part A. Cosmetic surgery, forget it. So you're not going to get any of these coverages. So ladies and gentlemen, this is a quick overview of what Medicare Part A covers, and most importantly, what Medicare Part A does not cover. I hope this has been useful to you, and in the next presentation, I'm going to talk about what Medicare Part B covers and what Medicare Part B does not cover. If you would like me to produce any educational videos as far as insurance are concerned about your health, please leave us some comments below and we will be happy to do the research and bring the information to you in a simplistic manner that both you and I can understand. And please do subscribe to our channel. I will see you next time.